sorry he can't be here, but glad to be here as a first-timer. So the case that pulled was one of a 55-year-old diabetic patient who presented with a acute on subacute history of abdominal pain, acutely worsening, and CT was done in the ED and showed this area at the gastric fundus with air and fluid sort of penetrating into the spleen. There are these areas of splenic hypodensity and abscess sort of extending into the lower abdomen, left retroperitoneum. And so ultimately, the initial read on this was concerned for like a complicated gastric fundal diverticulum with ulceration and perforation versus possibly a ulcerating mass. Subsequently, she did undergo endoscopy with biopsy of this area at the gastric fundus, which you can see on coronal. That was negative for malignancy and showed, reactive changes in the mucosa, and then was notable for these crystals. This is not her histology, but an example of the case what this turned out to be, which was Sevelamer crystal deposition disease with mucosal erosion. And so Sevelamer is a dietary phosphate binder that end-stage renal disease patients on hemodialysis take with diet to reduce blood phosphate levels. And so it's reported in the literature, there are cases of this entity. It's interesting, usually it's just associated with mucosal ulceration and not frank perforation. And the cases that I found reported were more commonly in the colon. Didn't actually find any other cases of gastric perforation like this one.
What is it called again? Like, what is that entity?
That's very new.
Or Renvela is the trade name.
Renvela.
Yeah, it's a
Your
dietary
patient
phosphate.
on Renvela, if they have renal failure and they have ulcerated or perforated viscous.
Yeah, and diabetics are reportedly more susceptible. One small case series noted a female preponderance as well. Still a rare entity, but it is in the manufacturer's packaging as a potential complication.
Fascinating.
That's new.
All right, thanks, guys. I'll turn it back over.